here at the Cannabis Alliance. We are dedicated to the advancement of a vital, ethical, equitable, and sustainable cannabis industry. And a lot of that has been brought forward here in Washington through the work that we have done dedicated to patients. And we've been talking a lot about Schedule 3 and, of course, helping businesses try and figure out how to navigate their way through Schedule 3. However, we do think it is really important that we're also keeping patients at the center of this conversation, those that sort of brought us here in the first place, and making sure that we understand what the partial rescheduling means for patients. And so, in an effort to understand that better, I have asked Steph to join us today. Steph is the board president and executive director for Americans for Safe Access. She is a pioneering international leader and expert in medical cannabis patient advocacy. Steph's career is defined by her commitment to eradicating inequities in health and well-being. Under her leadership, Americans for Safe Access achieved significant milestones, including establishing state medical cannabis programs, safeguarding state laws through impact litigation, ending federal interference with those programs, and securing protections for medical professionals. Some of you already know Steph personally from the work that she's done here in Washington State. Americans for Safe Access also championed the creation of the first product safety standards for the cannabis and hemp supply chain in partnership with American Herbal Products Association and the American Herbal Pharmacopoeia, removed federal barriers to research, collaborated with the World Health Organization to acknowledge the plant's therapeutic benefits, helped change the international scheduling of cannabis and drug treaties, and provided guidance and data to the FDA towards recognizing currently accepted medical use for cannabis. The impact is profound. I'm so grateful, Steph, for you to be here today. And now this time with recording, I'll let you take it away.
Fantastic. Well, thank you so much for inviting me here and asking me to talk about patients. Because as you mentioned, there's definitely a lot of pondering about what's rescheduling means for businesses. And I feel like that sort of focus isn't new. I feel like ever since we heard from HHS that they were recommending Schedule 3, which means and only means that it's being recommended Schedule 3 because it has accepted medical use, that is about patients, but patients are often left out of that conversation. So I also am going to share the presentation, Carolyn, with you and your members. And so in my presentations, I go through a lot of slides, but there's sort of a lot to cover. And uh, I don't know if you want me to wait and take questions at the end after I present. Would that be best?
I think that probably, if you are okay with interruptions, I think we can put Q&As in the Q&A box. That does exist. And then I don't know how you feel. If somebody has like a really pressing, hey, wait a second, I need to know immediately more about that, go ahead and raise your hand and we'll see. How do you feel about that?
Yeah, no, that's great. I would say because I know what is in the slides, I know what questions are going to come. I have some natural pauses where I'll stop
Perfect.
and I'll just ask you if there are any questions. I'll grab a sip of water and then we'll keep going.
Sounds good. Thank you.
Of course. All right. So I call this presentation New Patient Rights, Upcoming Fights, and Medical Cannabis Advocacy in a Post-AG Order, just because I like long titles. Um, So I want to start with what I think is the most exciting thing that has come out of the AG order. Um, Although this is most exciting for patients who are registered with their states. And everything that we're talking about as far as the AG order and the scheduling protections, they only apply to individuals that are registered as a patient with their state program. And so that means for a lot of patients, especially in states that have dual programs, I mean, Washington State, it's hard to at times find what a medical program is. I know that there was just a big fight that was won to get rid of taxes for patients. But um, the now that state medical cannabis programs that have applied for the DEA registration are legal under federal law, that means that patients have federal rights. And that means that we are protected under the Americans with Disabilities Act, the Fair Housing Act, and Section 504 of the Rehabilitation Act. And so I'm going to tell you guys a little bit about what those rights are. But I feel like a lot of the work that we're going to be doing is educating patients about those rights and how to exercise them. So I'm going to switch over to the DEA hearings that are happening right now and then go back to the AG order, because I think there's also a lot of misinformation about what's happening with these hearings. Um, and so the DEA hearings that are going on right now in DC, this is part of sort of a normal course for the rescheduling of a substance. And for a lot of people, you may not know this, but cannabis is not the only substance that gets scheduled and people want it rescheduled. Actually, a lot of patient advocacy um, actually deals with the scheduling of lots of medications. One, because the lower on the schedule, the easier they are to access, as we've seen in a lot of debates. Now, this hearing is the same process that was started by Biden in 2022. And so, of course, he initiated that process by asking HHS and the Department of Justice to look into the scheduling. And that process includes having HHS FDA determine whether or not there is currently accepted medical use and also look at the risk for abuse. And in 2023, HHS came out and said that there is, in fact, currently accepted medical use and that should be Schedule 3. That triggered the Department of Justice issuing a notice of rule change. And that was followed by a public comment period where people asked for a hearing. And so, as the sort of process goes, um, the Department of Justice put a notice of hearing for the rulemaking. And it was kind of a messy process. The DEA was kind of all over the place, but they did select witnesses, and the hearing was scheduled and about to start, and then it was postponed, mostly because of just some sloppy procedural things with the DEA. And so the order just happened actually restarted just the administrative hearing process. So what the DEA did is they withdrew the notice of a hearing. They got all mangled up and put a new notice of hearing. And so this is where we are in the rescheduling process. So after this hearing, which by the way, this is a non-binding hearing, and there's been a lot of news in the cannabis world, especially that this is some type of fixed hearing because the only people testifying are anti-cannabis people. But that's actually how these administrative hearings work, right? What the DEA has proposed is actually moving cannabis from Schedule 1 to Schedule 3. And so their witnesses were defending that decision. And so they were there talking about the medical use of cannabis. And those who can prove that they will be harmed by the schedule changing, those are the people who are testifying at these hearings. That's what they're for, right? Is to hear people that have a problem with it. And in this case, it's people who are very anti-cannabis. And the harm that they are showing, like Sam, most people know that organization, they're showing that they're going to have to pay, they're going to lose money because they're going to have to change their education, which may sound a little silly, but that's what's happening now. And at the end of this hearing, the judge is going to say, I agree, should be Schedule 3. He could say, actually, I think it should be Schedule 2. Or he could say, I completely disagree and it should be Schedule 1. He can't say 4 or 5 or deschedule, right? He has to like, respond to what is in front of them. But the DEA doesn't have to listen to the outcome of this hearing. And in fact, the last administrative hearing that we had back in 1985, uh, the judge who was proceeding over that hearing, actually concluded that cannabis shouldn't be on the scheduling at all, but it should definitely be at least Schedule 2, um, and said that it was one of the safest substances um, that he had seen, and that keeping it away from patients would be arbitrary and capricious. And the DEA said, you know what? We don't agree with that. We're actually going to create this new standard for approving currently accepted medical use. And we've sort of been in a long process since then. So after the judge says whatever his ruling is, and there's not a time limit, he could go uh, not too far out, but it's not like he has to respond in 30 days. Um, and so after that, then the DEA will issue a final rule. And when they issue that final rule, that is law, but there's a 60-day judicial review period. And that's where we'll see probably the people that are testifying um, take issues that they had with either the process or the findings themselves to court and ask them to overturn it. So, a lot of people have been referring to this hearing since the AG order as the adult use hearing. This hearing is not about adult use. This hearing is about cannabis. Um, and it's basically deciding whether or not cannabis, the plant, from the proposed rule, is going to be moved from Schedule 1 to Schedule 3. Now, if if they move forward with moving cannabis from Schedule 1 to Schedule 3, it doesn't mean that it's legal, right? It is still a controlled substance, and any possession of a controlled substance outside of uh, the uh, the supply chain or chain of command uh, of a DEA registered business is considered illegal, right? And this actually, in the proposed rule, the Department of Justice reiterated this, right? It said that, they wanted to be clear that the state programs um, are still acting outside of the Controlled Substance Act. And so before the AG's order, when we were just looking at the rescheduling, there was a lot of debate about what it meant. And as patient advocates, we felt like this was a game changer as far as being able to talk to members of Congress and being able to, have our medicine recognized, right? But it wouldn't have legalized the state medical cannabis programs, and it wouldn't have created any immediate protections. And there is within the cannabis business community, um, they often talk about how that Schedule 3 will mean that all businesses will be able to deduct business expenses, which is why they are, um, excited about scheduling, even though it doesn't legalize their business. And there's a little bit of a confusion here that honestly, both cannabis businesses as well as our opponents keep reiterating, which is it is true that Schedule 3 would remove the application of 280E, right? So 280E would no longer apply to those businesses, but that's not the only tax code that has to do with illegal businesses. In fact, in the United States, you have to pay taxes on any money that you earn. Even babysitters are supposed to be reporting their income. But if that income is received through an illicit means, you cannot deduct business expenses. You can't, you have still have to pay taxes. And a perfect example, I think that most people know, is like Al Capone, right? That's what they got him on, was for not paying his taxes. And so there is still going to have to be either a change in tax code by Congress, allowing illegal businesses to be able to deduct business expenses, or Congress is going to have to make those businesses legal. Now, for anyone who applied for a DEA registration for a medical cannabis business, um, they are legal businesses now, right? They are able to deduct business expenses. But I just want to remind people that, Schedule 3 um, substances are still have steep criminal penalties. Uh, you know, I think this is something that we're seeing. We definitely saw the Department of Justice put in the proposed rule, reminding people that um, these penalties are real and steep. Um, and I think that there's a lot of hope for like some silver bullet to come and create legal space for cannabis. Uh, but this is only going to ultimately happen through Congress. Congress is going to have to make these businesses legal. And then, so now I'm going to move over to the AG order, which is definitely a first in the history of the Controlled Substance Act. Uh, but a little piece of history that a lot of people may not know is that our Controlled Substance Act, that created the war on drugs, it was only possible because we signed on to these international drug treaties, right? And so before we signed on to the drug treaty, because of our federalist system, because the federal government before the drug war was not able to arrest citizens in the state. The federal government had very little power. The only thing that the federal government could do to to curb cannabis was tax it. So there was the Marijuana Tax Act that created a $100 to $1 value, which made it, hard for those who were using it medically. But once 1961 was when the first international drug treaties were created, and actually the U.S. we there was a lot of debate about whether or not we should sign on because the requirement of us signing that was the creation of the Controlled Substance Act. So in 1967 we signed on. And then three years later, we had the Controlled Substance Act, and that's what put cannabis in Schedule 1. And so the reason I mention that is that the actions that the AG took um, are basically in line with our direct result of powers that were granted to the AG through the Controlled Substance Act that has to do with us adhering to these drug treaties. So um, the 1971 Psychotropic Substances Treaty, uh, this is the one that basically gives the AG the authority to make sure that um, that our scheduling system mirrors the scheduling system at the UN, right? And so in 2020, we were successful in changing the scheduling in the drug treaties to recognize the medical use. And so what the Attorney General did was used his authority under USC 811D to um, to make sure that to show that there's medical value in cannabis, that our scheduling system recognized that. And then under the 1961 treaty, there's guidance there on how to regulate highly controlled substances for medical use and research. And then also in the order he mentioned, he referred to the rescheduling process and that HHS had found that there's accepted medical use. But he said several times that we don't even have to worry about that because I have this power under USC 811D. So the drug treaties, when they were first created, here in the United States, we experienced them a little differently than other countries because of our drug war. But these treaties were actually created to ensure the availability of these drugs for medical use and scientific purposes and to prevent diversion, right? But because at the UN level and here in the US, law enforcement agencies oversee those treaties, it feels a lot more like, and we see a lot more focus on the prevention of diversion than making sure that these substances are available. But that is why part of why it was such a big deal when we changed the scheduling in the international drug treaties, because it creates an obligation for member states to make that those medicines available to their citizens. And so that process to reschedule cannabis meant that we actually had to convince the World Health Organization to put out a paper that was an expert committee on drug dependence. It took years for us to get that process going, and then it took years for that process to complete. But in its conclusion, WHO said that there was, in fact, therapeutic benefit of cannabis. And then in 2020, the UN Commission on Narcotic Drugs actually changed the scheduling in the treaties. So I'm going to stop there just a second and see if there's any questions. I'm going to get into some of the nuts and bolts of what this means for patients. But that's sort of the technical side of what I'm going to be presenting.
So I do have one. Earlier on, you had said something to the effect of the Schedule 3 is acting outside of the CSA. Um, do you mind saying what is that? Do you mind saying a little bit more about what that means exactly?
Yes.
Yeah, thank you.
Yeah. Under Schedule 3, 1, 2, 3, any of the drug scheduling, any substance that's on the schedule that is being manufactured, cultivated, sold, or possessed outside of the chain of command of DEA registration is illegal, right? And so when
Hmm.
we went to the states and started passing the medical cannabis laws, we were doing that in violation of the Controlled Substance Act, right? And so the
Hmm.
distribution programs that we created were acting 100% outside of the Controlled Substance Act, right? Until April 28th, all of even though people had state licenses, they were not recognized at the federal level. And I know that there's a lot of new people in the cannabis space who maybe, don't remember the raids or the federal enforcement. But cannabis is still illegal. We just every year since 2014 have passed a amendment to the Department of Justice's budget, prohibiting them from spending any funds in enforcing cannabis laws in those states. And so the only thing that is keeping adult use businesses open is just the will of the office of the president. Tomorrow, the president could start arresting everyone who has an adult use business.
And then for those that are, because nobody's been approved yet, so even if people are operating, have, submitted their application and are operating, with the assumption of now being Schedule 3 as a medical license,
Those people are
is that
protected.
those people are protected as
Yes.
long as they're meeting the Schedule 3 requirements of once it's in, it stays in.
And that it is
And
that
then it
there's
is
a
a
medical only supply chain. Yeah,
Okay. And I think there's going to be lots of questions about that medical only supply chain, maybe later that you might just touch on anyways,
of
in
course.
particular with how it relates to the medical system we currently have set up and how that's going to match up with what the federal government wants. So we'll save those
Yes.
questions for a little bit later.
Yes, yes.
Thank you.
Okay.
Oh, I think I had one other one
Oh
for
yeah, go
you.
ahead.
Oh, sorry. Um, what are the prospects for safe harbor? John, I'm not sure. Do you want to add a little? Maybe I can unmute you and you can, let me find you. Go ahead, John.
Well, so we have a recreational program
Yep.
because it was the only access we had to medical. And so that created a safe harbor for all of our cannabis in this state. Now the federal government has given or will give an option for a medical program because that removes safe harbor for recreational, which was premised on that's the only way for medical use
Yeah.
in this
So
state.
yeah. So I think you're and it's confusing, but there has never been safe harbor um, for adult use.
I think
Um,
there's memos to that effect.
There's not. There was under Obama, he issued some memos that were guidance memos for U.S. attorneys that said if these businesses are following X, Y, and Z, then make it, it's the lowest priority for U.S. attorneys. But in Trump's first term, his attorney general was a little leprechaun named Jeff Sessions, who was very anti-cannabis. And one of the first things he did was actually tore up those memos. And we were actually bracing for another round of federal raids on adult use because he thought he was going to be able to go after medical, but couldn't because of the CJS. But then, he upset Trump. And so really adult use can thank Putin for that sort of lingering safe harbor. And then the Biden administration also did not issue memos and just sort of let it ride. But even those memos, they were just guidance documents. And in fact, under Obama, there was one guidance memo that came out, and then there was sort of a 1984 sort of correcting the interpretation of what that memo meant. And so a lot of people got raided, and a lot of state um, it was actually kind of led by the state. In fact, Washington State was definitely sort of leading the charge in trying to stop us from having a medical cannabis program there. Um, and so, and I'll get to this in more detail in a minute, but there's work that we're going to have to do at the state level and the federal level to protect patients and patient access. And the adult use access as far as the federal level goes is has a bit of a different path than medical. And I'll be able to explain that a little bit more in the presentation as I go through it.
Okay, thanks, John. Thanks, Steph. I'll let you
Sure.
continue.
Okay, so in the our sort of big vision of integrating cannabis into our healthcare systems, we have been at the state level, which has really been what we refer to as compassionate use. Basically, a doctor has, in a sense, has said, here's a letter, go for it, right? There's not a prescription, there's not much guidance after getting a letter. And as we move into our goal is into a federal program, there's a lot of uh, items in the gaps, right, that we're still going to be working on. Our goal at Americans for Safe Access is not trying to pharmaceuticalize cannabis, but instead our goal is to actually change the definition of medicine and create a pathway for herbal medicines. And so there's still going to be some mishmash, right, between uh, the sort of access and products that we have now and what is going to evolve into the integration of medical cannabis into our healthcare system. And so for a lot of people who maybe have gotten involved in cannabis in the last 5 or 6 years, which is something I've encountered when I've come back to the United States to run ASA again, is I realize there's a lot of people who think that the state programs, um, was the goal of our movement. And in fact, patients were sent to the states after a federal medical cannabis program that was started in 1978 was shut down by Bush Sr. And after that was shut down, there was actually at the time he shut it down, there were a lot of states that were um, you know working to get to basically become the distributors of medical cannabis in their states from the federal government. And once that whole program, the kibosh was put on that program, that's when we started seeing activism in first in San Francisco and in New Mexico, and then and Georgia, a couple other states. And then, of course, most people know about the Compassionate Use Act that was passed in November of 1996. But that sort of started this big experiment that we've been a part of. Uh, but for patient advocacy, we've always been looking towards a national medical cannabis program. And when I founded Americans for Safe Access in 2002, there was actually a rescheduling process that had just concluded in 2001. And the Department of Justice, DEA, basically in those documents said exactly what needed to happen in order for there to be federal recognition of cannabis medicines. And that included, product safety protocols, addressing the scheduling in the UN, being able to identify the constituent components in cannabis. And so at Americans for Safe Access, that's the strategy that we've been working on for 24 years. And the state programs we saw as triage to get patients off the battlefield of the war on drugs, and create a safe place where they could access cannabis, where we could make sure that that it was tested, that it was not contaminated or have adulterants, and really where we are right now with the federal government and trust me, like it's very weird seeing the DEA arguing that cannabis has accepted medical use. That didn't just happen. That's really been a very intentional campaign. Um, that, to be honest, when I started Americans for Safe Access as a very cocky 25-year-old, I thought we were going to get through all of this in like 2 years. So, um, so a little bit longer. Um, but I think that a lot of the conversations I've been having since the order has come out is this sort of feeling that patients are served by the adult use program, that is serving all of the patient's needs, but also people thinking that the state programs will work forever. And there's a lot of roadblocks for patients to have access. And what we found in the dual markets is that it's harder for patients to find the products that they need. And so that's where our sort of vision, right, has been guiding us, is to make sure that any patient in the United States, no matter what zip code they live in or what's in their bank account, should have access to medical cannabis. And so the order, just to be clear, and this is sort of the weird part, because in the US, we don't have a bifurcated scheduling system. And what I mean by that is cocaine, methamphetamines, those are Schedule II substances, right? Because they have a high risk profile, but they also have a medical use. And so as soon as a substance is deemed to have an accepted medical use, it can no longer be in Schedule 1. And so the DEA in this other hearing, what they can do is they could say Schedule 2, but it would create a very messy situation that we haven't had in the United States. Now, other countries, and actually at the UN, there's even some bifurcated scheduling, but that is not how our system works. And so there's a lot of unknowns, right? I just want to be clear that I understand sort of the parameters of what like how the AG got to that decision and what it means in the short term. But this action has never happened before in the history of the Controlled Substance Act. I know we say that a lot under this presidency. Um, and so, there's a lot of unknown. Um, the part that is clear is sort of, because the Attorney General is invoking the UN drug treaties, right? Everything that um, a sort of implementation of that has to mirror the requirements in that treaty. And so, it's unclear what all the other federal agencies are going to do. I know that folks in states with dual licensing are unclear because even though businesses in Washington state applied for those licenses, it is unclear whether or not they will be able to ultimately get the DEA registration if they are still in the adult use market. And I'll get to that in a little in just a minute, Kaitlyn. Another question I'm getting a lot is, what does this mean for home cultivation? And um, sometimes in cannabis space, I tell people like it's like this is not something we necessarily want to push because there is almost no federal enforcement at the individual level for someone who actually is cultivating personal use. Now, if they're cultivating a lot, maybe they'll get on the radar of the federal government. But it's just not something that's in their purview. And um, the federal government actually, as part of our federalist system, can't tell homeowners what to do outside of the state. Like that falls within the state's purview. And so if the state has home cultivation, I think those states are going to be fine. I think those individuals are going to be fine. I don't think you should have to worry about federal enforcement. Uh, what I am hearing is for people who are in states that do not have home cultivation, they're hoping that this will somehow open up that right. Um, and I'll just tell you it doesn't, for two reasons. One, as I mentioned, as far as the federal purview of being able to dictate what happens on personal property, but also the UN single treaty and the International Narcotics Control Board have been very clear that they do not think that home cultivation um, can fit within the definitions of Article 23 and 28 of the drug treaties. And so I think that if your state has home cultivation, you're good. If it doesn't, there's not a avenue to utilize new federal laws to be able to get home cultivation. And so the challenge, I think, of where we are is that in our model legislation, which actually creates an Office of Medical Cannabis and Cannabinoid Control under HHS, not in DEA, not in FDA, and would create a new schedule, a Schedule 6, that actually has no criminal penalties. What the Attorney General just did is actually just phase one of our legislation, right? And so this is where things are going to get tricky, and really where we're going to need Congress to step in is that the Attorney General can't do anything else, right? Like they can't create a new licensing system. They can't, look at the people that applied and try to figure out if there needs to be new licenses, right? Because they're completely depending on the state to issue those licenses. And so, um, really the people who are in states that have medical cannabis laws, those are the ones who are benefit from this order, and everyone else is left out. Um, None of the other agencies outside of Treasury or the DEA have been given any instructions, which is a little confusing. And it doesn't address sort of regulations um, uh, for what would be called now hemp products, although that definition definitely wanes in a few months. It doesn't specifically address interstate commerce, although I do believe that if a state passed a law that said that it was okay with interstate commerce, that would be acceptable, but it would invoke the FDA and DEA to oversee, um, not necessarily to oversee, but it would give them jurisdiction, right? As soon as something goes across the border, that's when the federal government has jurisdiction. And of course, our legislation has the Office of Medical Cannabis and Cannabinoid Control at the center that deals with all of the other agencies, that works with the states, that helps plan if there are enough licenses to accommodate patients. Um, and without phase two and phase three, we're really going to be in a very weird sort of like frozen in time uh, aspect of who has access, who has rights, and who doesn't. Um, but there are, some uh, definitely some exciting things for patients. Again, as long as they are registered. And so I have to say, personally, I'm a resident of Washington, D.C. I am a certified patient, and I am not a criminal for the first time in 25 years. And it feels pretty amazing. And this is really something that I want every patient to feel. Um, I didn't, it's one of those things that you live with it for so long that you don't realize how much it affects you. It affects your decision making, but it's pretty awesome. And I definitely want to continue to fight to make sure that everyone has that. And a lot of those rights that I'm talking about are because the order says that our registration, our certification, or letter from a doctor, whatever the state requires, it is equivalent to a prescription. So it's pretty amazing. I've been speeding more. I'm just kidding. But you really shouldn't break more than one law at a time. Um, but there's definitely rigid borders around what is protected and what isn't. And you can see, as I was describing what happens just under Schedule 3, um, why the Attorney General would want to not only make sure that our scheduling was in line with the UN treaties, but also found a way to really shortcut, honestly, the FDA, because traditionally the only way to get a DEA license for a Schedule 3 substance is through bringing a drug through the FDA approval process. So it also doesn't do a lot of things. So it doesn't legalize cannabis, doesn't deschedule it, it doesn't legalize adult use. It does not apply to synthetic cannabinoids. It doesn't change the FDCA's requirements for approval, safety, labeling for all businesses that are on the pathway. So if you applied for a DEA registration, besides figuring out that your supply chain, how your supply chain is going to be medical only, you also have to include on your product labels a sentence that says that sharing your medicine is illegal. It's actually right in the statute. So there's a lot of those sort of little pieces. Um, it doesn't provide access or protections in states that don't have laws. It doesn't affect the status of hemp. Um, it doesn't allow patients necessarily to travel freely. Although there was kind of a rumor that TSA had changed their policy, but they hadn't. And basically, it's sort of one of those policies that ends up being racist or used against honestly poor people. Is that if the TSA decides to call the cops on you, they can. Um, and it doesn't get rid of past criminal records. It doesn't change the criminal penalties for anything that's outside of it. So that's why they specifically said that adult use is still Schedule 1 under the AG order. Um, and it doesn't automatically update all of these federal policies uh, that have been treating cannabis like an illegal substance. Although arguably, I believe we have those rights, and if those policies are enforced, I think that we're going to see a lot of lawsuits. Um, but it also doesn't allow active duty military to be able to use medical cannabis until the DoD changes their policies. So, we have put together a lot of materials to educate patients about, what this order means. We have posters, we have videos. I'm doing a presentation every other day to make sure that people understand these rights. But something that's really important to understand about our rights in the United States is they only exist if we exercise them, right? And an example is you have the right to not talk to a cop if you're in custody, but if you don't shut up, right, you've waived that right. And so the same is true with exercising your rights under the Americans with Disabilities Act. You have to ask for, reasonable accommodation. But those rights are ours. If our medicine is legal, then those are our rights. And so because it is equivalent to a prescription, um, that means that these protections exist for us. Um, I think most people are familiar with the Americans with Disabilities Act and probably even the Fair Housing Act. But honestly, one of my favorites is Section 504 of the Rehabilitation Act, which I think is going to turn a lot of the work that we've been doing at the state level on its head. Because this statute basically says that any hospital, any facility that is getting either licensed or funding from the federal government could lose their licensing or funding if they're in violation of the Americans with Disabilities Act, which means that when patients go into a hospital, if they are not finding a reasonable accommodation for us, that could be a lawsuit that could end up in them losing their license, which really is a turn of phrase for the fights that we've been having with these facilities for the last 30 years, where hospices and hospitals have told us that they can't accommodate patients because they could lose federal funding. Um, but these protections depend on you're registered in the program. And I think after probably December, once the DEA has given out the registrations, um, it's really going to depend on if your supply is legal, right? And an example of this was, if you get a prescription for codeine from your doctor, that is legal. No one can take it from you. If your aunt gives you a handful of them, that is illegal, right? And so we're really moving forward into a legal program. And for folks who maybe don't remember what this was like at the state level, when we passed state laws in distribution laws in states like California and Oregon and Washington, just places that had established cannabis markets, there was a lot of growing pains, and I think those still exist in many cases. And that is what is happening now. We're moving into a federally recognized program, which means, new licensing eventually, and new rules. But this affects a lot of patients, affects a lot of people. I think where we're going to start seeing some bumping of heads at the state level is that because our medicine is now considered a prescription, a Schedule III prescription drug, that it can't be taxed. And that means not at the retail level, but also the supply chain as well. It means we can own a gun. I know a lot of people saw the Supreme Court case and think it's fine for any cannabis um, uh, anyone who's using cannabis to own a gun. But something that hearing, that decision did not do is it did not take away gun enhancement charges. So if you are committing a federal crime and you have a gun, whether it's you have it legally or not, there are 5-year mandatory minimum enhancement charges. So if you are a legal medical cannabis patient, you can own that gun legally and not have to worry about those additional charges. And I mentioned before, every federal agency currently has policies on their books that are in violation of these rights. And so that's something in the short term that we're going to be working on. So we're educating patients to get registered, but we're also working with the states to try to have state regulators help us educate patients, especially in dual license states where there wasn't a need for patients to be registered. We are going to be lobbying governors and state legislatures to create a pathway to build up enrollment. Something I keep hearing from cannabis businesses in dual market states is that there aren't any patients in their state. And that is absolutely not true. There may not be that many registered patients, but if this is the market that we're going to live in, then we need to help patients get registered. And I think that by educating patients to understand that their ID card now means that they can't be fired or evicted simply because they're a medical cannabis patient, I think we're going to see a lot more enthusiasm about enrolling in these programs. But my experience of the last 24 years has told me that I've never seen a medical cannabis program be implemented without hesitancy in various agencies. And in fact, one of the first things that Americans for Safe Access did in California was that we actually started suing. We had to sue every agency in California to actually adhere to our state law, right? So we had to sue the California Highway Patrol, the DMV, we had to sue cities and counties, and then we found attorneys in Colorado and in Maine and actually in Washington, and worked with them to get those similar cases won in those states. And then eventually every new state that we passed a medical cannabis law, they included those protections because they didn't want to get sued. But it took a lot of work, and I'm expecting that we're going to be seeing something very similar as we start to implement this new federal law. And so we've created, we have a campaign to end medical cannabis patient discrimination. And we're asking people who experience discrimination, whether it's in housing, healthcare, at hospitals, hospices, nursing home, um, through like family education, like child custody issues, really anything, employment, federal employment, if they're getting pushed back for veteran services, military, and even private businesses. The Americans with Disabilities Act requires that businesses make um, reasonable accommodations to meet the needs of patients. And so, again, that can feel really uncomfortable for patients. I think a lot of us just thought that we were going to have to live as the sort of shadow citizens in this country forever. And so we've created a lot of materials to help patients assert those rights. And those include, this is actually one of my favorite things I've ever written working on medical cannabis, is you can go to our website under Claim Federal Protections, and we have these letters, one for patients and one for caregivers, that is a notice of federal legal status and non-discrimination rights of medical cannabis patients. So this is a letter that patients and caregivers can use to help express their rights to landlords, hospitals, etc. Now, it doesn't mean that they're 100% going to say like, okay, thanks for this letter. I'm going to let you use cannabis. But what the letter does do is it asks for the reason that they cannot accommodate you to put that in writing. And again, it's our role as patient advocates to document these injustices, make sure that we are giving patients the tools they need to assert their rights, but also be ready to take bad actors to court if needed. Again, we have all sorts of outreach materials you can use. We've created these posters. The one on the right is, we designed it so it won't take up that much ink out of your printer. So, on your way to the dispensary, or grocery store, just print one of these and put it up. And you never know what patient is going to find it who has no idea what is going on. We also, at the beginning of the year, looking at the hemp issue with the closing of the loophole, we actually put out this guidance document for states to try to figure out how to accommodate these patients. Now, we weren't talking about accommodating intoxicating hemp products. What we were talking about is, the patients who can no longer find their products on the shelves in dual license states, who found themselves depending on the hemp market, as well as those patients who live in states without any protections. And the next guidance document that we'll be putting out in the next couple of weeks is going to include some of those recommendations, as well as new instructions for the states to make sure that patients' rights are being met, but also that the state is preparing for this new landscape of federally legal medical cannabis. So I'll pause there for just a second. Kendall, I was going to go into reading some of the tea leaves of why we think that there may be enforcement actions around the corner.
Yeah, perfect. I think we have one lovely question from Mary Jane Oatman, who says, "Love you, Steph. You're a
Hi,
rule
Mary Jane.
breaker. Yeah, keeping it real. No question except what are Steph's top two favorite strains?
My top two favorite what?
Strains, cultivars.
Oh, well, actually, I'm having kind of a sad issue that a cultivar that I have depended on for now almost 17 years, that uh through a home through home cultivation, well, caregivers cultivating, just got uh, a uh, a disease basically, and it's gone. The cucumber is gone. It was a type of sour diesel. Um,
Ooh.
but so I'm trying not to think about that. Thanks, Mary Jane. Just kidding. Uh,
No.
no,
Well,
it
I think it speaks to, so what you talked about, because we have seen that 100% here in Washington State about how the medical access to the actual medicine that people need has begun to shrink, and has shrunk so significantly. I think that it is almost impossible to find your medicine represented in stores now. And so,
it's also why we need and will always need patient cultivation.
right,
That
which
really um, the diversity that keeps. So whether it's legal or not, and I want to be clear, like I'm just telling people what is legal. I don't necessarily agree with any of these laws, but the reality is. Cannabis was my medicine before April 28th, right? And it's continued to be my medicine. And it's always a very weird day when you realize that this thing that is going to keep you alive makes you a criminal. And I know a lot of patients have faced that. I wasn't a cannabis user before my neurologist brought up cannabis to me. I was 23 and my kidneys were starting to fail because of anti-inflammatories. And this poor little 80-year-old man asked me if I smoke pot. My neurologist asked me if I smoke pot. I told him I didn't, and he asked me if I knew where to get some. And I think I asked him if I was his youngest patient because I thought he was trying to score weed from me or something. And this was in 2000, right? And so he's like, no, 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 no. But if that man hadn't brought that up to me, I don't know where I would be. And so I'm so grateful not only to this plant, but also to the people that I've met over the years. And like I know several people who are no longer with us in Washington State who, in their last days of their life, sat in hearings at the state
Mhm.
capitol or sat in courtrooms. And really, when I hear legacy, that's what I think of. Those are the people that I have to keep fighting for. Because to be honest, as a privileged white girl without kids, like I wasn't going to go to jail for cannabis. I could have kept getting my cannabis from skater punks and people who listen to reggae, but which is where I first got cannabis, and when my doctor recommended it. But I think that we have to, even if this news isn't what you want to hear as a business necessarily, you I just invite people to think about what this means for the patients. And obviously our organization has always been grateful for those who have been committing federal civil disobediences to bring us medicine, which is why we pass legislation to protect people every year, even though they don't know it exists, um, or why it's there. Um, but you know, I know that businesses are struggling. I know it's a scary time. But this is really a time, I think, for all of us to think about us as a community again. And, just be wary of I've seen this sort of cycle through cannabis businesses over different periods of time. And I see it's an Aesop's fable about a dog and a bone who is walking along the river's edge and he sees another dog with a bone and he goes to grab that bone and loses his bone too.
Mhm.
And the reason we have protections is that we have been acting as a collective. We have been collectively committing federal civil disobediences, and we're not yet at the point where there's a competitive edge to be alone.
Oh, I like that. That's, I think, a really important reminder to all of us that there is no competitive edge to being alone. Um, I think I'm curious to hear what you think about right now in Washington State. This is sort of a preemption question.
Mhm.
In Washington State, we have qualifying conditions written down in statute that are pretty restrictive. So we don't like like sleep issues, anything other than treatment resistant intractable pain is not on there. Some anxiety is not on there. A lot of the ways that people use cannabis medically are not allowed by our state statute. Now with Schedule 3, there is sort of like a different set of qualifying conditions, and a lot of that's left up to physician discretion. Um,
But why, not necessarily. Why,
okay, I'd love to
uh,
hear more about that.
so actually and this is where this is why this is a time to activate more than ever, because what the Attorney General order says, right, is that whatever's in the state is what's in the state,
Mm,
right? And so only, so this is where it gets weird. Only DEA registered um, substances, right, are legal. And usually those are substances that go through the FDA. But what the Attorney General has done in this very unusual order is he said, you know what, I'm trusting the states that they're doing X, Y, and Z, and so we're going to give them DEA licenses. And as of right now, whatever is the law in the state is the law, um, except
mm,
for adult use being where they get their access. So one of the
right.
only things that the Attorney General said is not okay, right? Is that it is adult use. And so and that is also like it when especially when you look at the treaties, and what is in the treaties is that there is no such thing as adult use at the international level. There is medical use and there is non-medical use,
Hmm.
right? Like that is how that and that is true for all Schedule 3 substances, right? There's not adult use codeine, right? Like purple dank drink
Right.
isn't legal, right? Like it's not it's it's cough syrup with codeine, but it's a Schedule 3 substance and it is illegal, right? And trust me, the people who sell purple drink are not deducting their business expenses. Although I would like to see those tax filings with like a big bag of Jolly Ranchers.
Right.
Um,
Um, I do have just a couple more small questions. Also around taxation, you touched on it a little bit, and what you had on the slide was sales tax. I think here, and we have the highest excise tax in the nation at 37%.
it's
We did
ridiculous.
have a temporary win of removing that tax for patients.
Yep.
It is on a 5-year clock with an impact study that's about to get started here pretty soon. And so I think so sort of we're trying to figure out, is the excise tax also not applicable, or our understanding is we don't tax medicine, period. And I don't know that you have an answer for that, but I'm curious to hear your thoughts on it.
So, I one thing I also wanted to remind people that I know this can feel a lot of times people just want to be like, what's the answer? What's legal? Like, what do we do? And I just want to remind you all that everything that you're a part of in cannabis has has been made up. We totally made it up. I can't tell you how many people told me that there would never be a state oversight over cannabis, right? Like, oh, is it crazy? So part of advocacy means knowing what you want and and knowing when it's time to grab it. And um, the state may say, we don't agree that uh, they would be considered pharmaceutical ingredients, right? Don't deserve a excise tax, but that's too damn bad, right? Like it's our medicine. And unless they want to go into the state law and change their policies on how they tax medicine, then our medicine and the supply chain that brings it to us is not taxed. So I think we're going to have fight for sure. And that's why I opened this by saying our new rights and our new fights, right? But like every time the chessboard gets bumped, every time those pieces fly into the air, it's an opportunity for us to make sure they land where we want them to. And the only way to do that, right, is to claim that space and educate everyone along the supply chain to act accordingly. And that's why a lot of the work that we're doing right now and preparing for is actually educating, yes, we're working on trying to pass federal legislation. Yes, we're going to be trying to pass state legislation to help, in this sort of middle ground space that we're in. But we're also educating social workers who are the people who are dealing with patients in between the hospital and hospice, right? That they become advocates for them to have access to medical cannabis. We're educating, working with like nurse practitioners who are compassionate workers. We are, we have to create the guidance for everyone to be able to implement these laws the way we want them to. But
Right.
like I said, I'm going to send you
Yeah.
this PowerPoint and a PDF so people can have it. I know I use a lot of slides, but I just feel like there's a lot of information, and that's why I give a presentation and give you the slides so that in case you didn't hear something. But I do want to just really put people like wake people up that there are a lot of reasons to believe that there is federal enforcement coming. That this again, the adult use market is not protected. The DEA registrations create a very clear line of who is registered and who is not, right? And because the deadline has passed, if somebody wants one of those licenses, they can still apply, but they can't legally operate until they get that license. Right? And a lot of businesses are like, what, that's fine because I've been breaking federal law for years, and that's true. But Trump has gone way outside of the leadership of the Republican Party on his support for cannabis, and literally, like everyone in the Senate leadership, the committees, chairs of all of the committees that affect cannabis are anti-cannabis. Um, Project 2025, which has been the blueprint for this administration, includes several references to enforcing federal law in states that have created laws that have made the public unsafe. We've actually seen the Department of Justice has put out orders last year to U.S. attorneys telling them to arrest um, uh, people first and prosecute simple marijuana possession on federal property. Um, there is currently a cannabis RICO task force that has been created. And in the state of Oklahoma, the Oklahoma Narcotics Bureau actually told all of the cannabis businesses, which they're all medical, but basically said if you do not have a DEA license, you are going to get shut down. And so that matched with the fact that there is a growing sort of backlash to cannabis. Um, a lot of it's around public health, that hasn't been addressed. The National Academies put out this report in 2024 that listed a lot of public health concerns that haven't been addressed. We saw this in like this, the New York Times editorial that was a really stupid editorial, but it's sort of a symptom of sort of these unaddressed public concerns. And we're seeing, growing efforts amongst parents groups. And of course, Sam is really weaponizing all of these concerns. So something that, just because you as a parent want to know, how to talk to your teenager about cannabis doesn't necessarily mean that you want prohibition. But if no one else is addressing your concern and Sam is telling you it's the only answer, like that's the sort of tension and the environment that we're in. So, this graph, I actually looked at all these sound bites that Sam puts out and actually could tie them back to real and legitimate concerns of parents and medical professionals, public health um, advisors, and organizations, employers, and patients. And in fact, Sam A lot of times the quotes that are coming from Sam, it sounds like a lot of advocates. They're talking about the fear of big cannabis. And so there is a sort of deer in the headlights thing that's happening to a lot of people that I talk to, and they keep telling me that they're going to wait and see. And I just want to encourage you, instead of waiting and seeing, like medical cannabis is legal in the United States. It's not legal for everyone, so we obviously have work to do, but let's push forward with that standing. And so just a couple of things real quick, Kellen, if I could just kind of run through some things for people to look for.
Yeah,
Um,
absolutely.
we put out this document last month for states to prepare for these new federal regulations and potential enforcement. This was part one. Part two, I'm going to be putting out in a couple weeks. If you don't want to read the report, which is not that long, but some people don't like to read, um, you can watch this webinar where I actually go through everything that is in the report. I don't like, it's not like story time with stuff, but I have a presentation on the report. But part two is going to be addressing tax-free medical cannabis, making sure that our civil rights are protected, that states are proactively telling employers and hospitals and folks that they have to create policies to accommodate patients, making sure that we can work with the states to create a clear medical only supply chain. And it may be just having those licenses there so that when we get more instructions or more information from the Department of Justice, those who applied for the DEA registration, can move into a medical only supply chain. In some states, it means we have to strengthen product safety. States need to be telling all of the businesses that they need to start putting some of these federal labeling requirements on their products. Um, States also need to be preparing for this hemp transition and for access deserts that still exist in these states that could only get worse if we start seeing enforcement. But I know a lot of the hemp enthusiasts say that this loophole is going to get extended. It's not. I'm just telling you, like, there's not a pathway for that. The president cannot make that happen. And so we need to prepare for those patients to have access. And some of the proposals that we've been floating in states is to find ways to integrate hemp into what is hemp today and won't be hemp on the 12th of November into the medical cannabis programs and create incentives for those businesses to create those products. Um, in states that don't have medical cannabis laws, I've drafted legislation that would create direct patient access that would, just the state would just create a registry and allow businesses in other states to just to send medicine to those patients. Um, so again, like this is a time to create. This is a time for us to say, like, we want every patient in the United States um, to have access, right? Like, even if they live in Wyoming or Idaho, it shouldn't matter where you live. Um, and so we have a ton of campaigns going on right now. When you get this presentation, each of the campaigns have QR codes and the URLs at the bottom. So I encourage you to talk to every single representative at every level of government that represents you. Um, you can sign on to this letter to Trump and the Department of Justice, asking them to tell all of the agencies to update their policies. We have this memo for Congress that actually shows how they can actually pass those, same requirements through the appropriations process. Everything we're asking Trump and the Department of Justice to do, Congress can do through appropriations. Um, we have this compassionate candidate campaign. So during August recess, we invite people to go to the site, download these materials, and ask the people that are running for office to represent you to sign a pledge saying that next year in DC, they're going to make creating compassionate access nationwide a priority. We also have this voter registration page because uh, uh, voting has gotten very confusing. So you can go to the site and make sure you know where to vote. I already said that. Um, Supposedly we'll have appropriations in September, probably not because it's an election year, but September is Cannabis Safety Month. Invite people. This is an opportunity to have some of these difficult topics, these conversations in your communities. Really reaching out to parent groups, to employers, and really listen to some of the um, fears that they have, and we can address those so that those fears don't turn into stigma and turn into what we know is harm for patients, like keeping patients from having organ transplants. So we know that if people have facts, that is going to create a safe environment for patients. Um, and those who provide us medicine. So if you want to participate, sign up. And then again, there's all sorts of volunteer opportunities with ASA over the next 3 months. But if it's been a while since you reached out to your elected officials, don't worry. We have like serious tools that make it super easy. As long as you know your address, we will get you in touch with your state, federal representatives. But I really challenge each of you to talk to every single elected official that represents you because they are actually more confused than you are. And that's it. Oh, and through the end of the month, you get 25% off, 24% off ASA gear for our 24th birthday. Oh my God, I've been doing this forever. Okay.
I was just going to say 24 years. That's incredible. Thank you so much, Steph, for all of the hard work that you've been doing for these 24 years, and for being here today to share all of that really great, important information. I think I've got a lot that I'm still sort of now sitting with about the imperative that we have now here in Washington State, because while we've been working very hard under one version of things, now it's time to get to work even harder on this next version of things. I'm thinking of things like we just passed our version of Ryan's Law here in Washington State, just in time for this to change, and to now start thinking at that national level of what that can possibly look like. So thank you so much for your inspiration and all of the ways that you can support advocacy about patients and medical cannabis. Thank you so much.
Of course. Thank you guys so much. And um, it's easy to get a hold of me. I'm Steph at safeaccessnow.org. And as after you've watched this presentation, I'm sure you're going to have more questions. And we're a community. I'm here. I'm obviously not going anywhere. Um, so as I'm looking at this 24
Awesome.
birthday.
Yeah.
So so yeah, and I think it's going to be a time of learning. There's going to be a steep learning curve. So even letting people know if something didn't work is just as important as letting people know that something is working. So thank you, everyone. Thanks for everyone who came to this presentation and who spends time advocating for patients.
Awesome. Thanks. I would like to, before we completely wrap up today, I want to invite everybody to mark your calendars, save the date for November 19th. We're going to be having our Medical Cannabis Summit. We'll start releasing that sort of lineup, but the Department of Health is planning on being there again. We will be having some town hall discussion, and especially after today, we have a lot to consider, in particular about the work that we need to be doing with the legislature come January. So that's going to be an excellent time to be able to have that conversation. Also, this is the last couple of days. If you want to come to Leavenworth and golf with us, we're still taking registrants. We have almost 100 golfers so far. And if you planned on doing it and you just haven't yet, make sure that you get that registration in. We're really looking forward to spending some time together outside next week in Leavenworth. And then if you are not a golfer, but you want to volunteer, we still have a couple of spots left for that as well. Just go ahead and reach out. We got a small stipend that can help support your attendance at that event. Otherwise, we also are only able to do this work through your donations donations and financial support. So if you feel that you can do that today, we'd really appreciate it. We hope you all have a lovely rest of the day today. Take care, everyone.